Okay class, today's topic is growth chart. Okay. It is already given as a spotter in your exam. I am very sad to see no one got 2 out of that question. I think second or third day 2 growth charts were given and first day was circuit step. Correct? Taito? That's why I put the class again. So, coming to the growth charts, first we have to understand what is growth. Okay. So, can anyone say what growth is? Anyone from this part? Sir, first bench. What is growth? Don't look like that you have heard it the first time, the term. Do you know now what growth is? What? What is growth? It is similar to Complan boy, Horlicks boy, whatever. Tell, you are starting to tell. Cell division, sorry, you do not have to go that cellular level. Cell division is increase in number, na? Is that growth? For the cell itself, is it growth? It is getting divided into 2, so it is getting increased in number. So anyone, sir, Subhrajyoti?
Growth is permanent, irreversible change in mass, height.
Irreversible?
No, reversible.
Reversible? যা বলছে একটু প্রসেস করে তারপর আউটপুট করো। টেল কিপ ইট, আরে প্র্যাকটিস করো, ওটাই বলো। এনিওয়ান এলস? এদিকে একটা গ্রোথ সিম্পল থিংস জিজ্ঞেস করছি, গ্রোথ কি? Increasing? So these are physical dimensions of body, है ना? अगर যদি এফএমটি তো পড়ছো, যদি আনআইডেন্টিফাইড বডি সম্বন্ধে কিছু বলতে হয় কি বলবে? কালার, হাইট, প্রবাবল ওয়েট। সো height and weight, these are physical dimensions. Also we know as it as anthropometry. Correct na? So growth is a dynamic process, it is increase in physical size of the body as a whole or any of its parts. So increase in size is growth, but we also as a human being, as we are capable of multiple functions, so we also added one another term, that is development. So it is increase in skill and function. So nowadays we do not only assess the growth, but we also assess the development of that child. শুধুমাত্র the child should not be increase in size only and brain is not developed. The developed word is itself development. And how we assess the development? I told the tool's name in family study. What is the name? There was a screening chart to assess the milestone if achieved or not. What is the name of the tool? Chalo. Trivandrum development screening chart 0 to 3, 3 to 6. Write it in your notebook, it's a potential MCQ questions, okay? Because right now we have achieved, as India has achieved its growth target. Now we are focusing on development and how to assess development rapidly, also in a grassroots level where it is done by some ASA worker or Anganwadi worker. It is Trivandrum development screening chart. It's a chart, it expands from 0 to 6 years and it is divided in 2 parts, 0 to 3 and 3 to 6, and development assessed in 4 domains, sometimes in 3 domains: gross motor, fine motor and cognitive or psychosocial, whatever you say, okay? That is development. And physical growth and development changes, it is usually ongoing normative and expected. These are the features that if it is asked what are the features of a human growth, it is always ongoing, it is expected and it is normative. A human growth, if it is not affected by some factors or determinants, it will go on its own, and that is we call as normal growth. Okay. But so coming to the what are the features, what are the determinants or affectors that affects the growth? These first, genetic. We all know some genetic factors which produces short stature baby. Any syndrome comes into mind? Dwarfism is the term. What is the cause? Turner syndrome. Okay. Is there any hormone deficiency? If not in Turner syndrome, that produces short stature? Growth hormone deficiency. Then coming to the nutrition. We all know what is the role of nutrition in growth and etc. etc. Then age. At a particular age of a human, the growth rate is different. Usually growth rate is the highest during 0 to 1 years of age. Okay. Then it was somewhat plateau phase. It will happen, it is ongoing, but the rate is very slow. Then again, usually male have undergone growth spurt, that during 12 to 13 years suddenly there is change in the hormonal balance and the growth is rapid. Again in the adulthood, growth is somewhat in plateau phase. Okay. Then gender. As like I previously said, during 0 to 12 years, that is in childhood, girls' growth rate is much higher than boys. Okay. Again, physical surrounding. That means physical surroundings mean the entire environment, your light, air quality, your living condition, everything. If a child is living in a cage, suppose, will the growth rate will be same? No. If there is lack of sunlight, the growth rate will be different again. Then psychological factors. It has been studied and established that factors like nurture, feeding time, and also if you care for the baby, appropriately and as per scientific reason, the growth rate is highest. Okay. The nurture also plays a role in the growth of the baby. If there is negligence towards the baby, his or her growth will stalled. Then coming to the infection. Infection means both bacterial infection and parasite infection. What parasite infection can cause growth retardation? যদি প্যারাসাইট হচ্ছে কি নিউট্রিশনটাকে না করে দেয়, if it prevents the child's nutrition, hook one. If are there any other disease where growth retardation is seen? Some congenital disease. Diarrhea কে বলছে? Diarrhea একটা রোগ রে. Diarrhea can be caused by multiple things. Is there any other disease have you read where congenital retardation has been seen? Congenital syphilis, very good answer. Another? Rubella. Okay. Note it down because it has been asked. Now coming to the economic. Economic and nutrition is related to one another. If there is low economic condition, so there will be less nutrients, provision of less nutrients. So there will be growth rate, slow growth rate. and there are other factors. Some established, some are not, you do not have to think about those, but rest of the factors it might become as a short note or 10 marks question. Okay. So, coming to the normal growth, when we say that it is a normal growth, for that we have to study human growth multiple times, and after study multiple researchers have done their research, and finally this is the growth after birth. Okay. General growth 0 to 1, the steep is highest, then it somewhat coming to the slower. At 5 there is a point, it coming this point, here the growth actually rate comes to a very slow spot. During the up to 12 years it is somewhat plateau, then again at 12 there is growth spurt. This general growth is in physical dimension. Also the reproductive organs, they also get their highest rate, growth rate, when at the age of 12, we call it as a puberty. And brain, the brain developed highest at 6, highest rate, then it comes to a plateau phase. That is why 0 to 5 years the growth of brain and the development of brain, it is now of utmost importance. Okay. This is a normal growth chart. So, first if we have to assess a growth of one person, we need some tools, and growth is we all know growth is a ongoing thing. So, if we map the child only once and see that it is a normal, is that correct process, or we have to measure his or her growth repeatedly? কি মনে হয়? What do you think? Do we have to measure only once, or do we have to measure it repeatedly? We have to measure it repeatedly or single time? Why? Because there will be some change, there might it affect. So, it can produce 3 types of graph, 3 types of trends. One is the child is getting better nutrition, suddenly there is drop or plateau, and it is coming not like the normal stage, it is coming as abnormal trend, not deviated from the normal curve. That is why we need a picture, and that is why that is where the chart comes in. যদি আমরা হচ্ছে গিয়ে if we note it down that we are measuring the simple things, only weight and height, measuring and written in a just the number. Will we able to see whether the growth is adequate or not? Is it deviated from the normal pattern or not? We need a picture, and also a picture is very easy to understand. That is why the growth chart is needed. Okay. And thinking of this, the growth chart is created also. Okay. First growth chart is created by David Morley, then it has been asked David Morley, write the name. Okay. And then there was CDC growth chart, Tanner growth chart, then came to WHO. After WHO growth chart came India made their own. Why? We will come to it later. Okay. So, what are the aims and rationale? To identify children with growth deviation and diseases and conditions, and secondarily to discuss health promotion related to feeding, hygiene. These are the other uses of chart, I will come to it later. So, this is the name David Morley. He actually made it popular. There was some previous persons who actually tried to do that, but this person made the growth chart popular. Okay. Where the growth chart is used, that is ICDS centers, Anganwadi center and well baby clinic. and in some PHCs also. Okay. The higher center or tertiary center does not have growth chart. Okay. We do not keep growth chart with us. Now coming to the WHO charts and CDSs, we usually here use WHO chart which developed in 2006 and 7 both, or ICMR actually made another growth chart, and also Indian Association of Pediatrics, they also made their own growth chart. Okay. But in your curriculum you only have to understand WHO growth chart or the growth chart in the MCP card, okay, which is made by MOHFW. So what are the uses of growth chart? These are the points. First, it is a diagnostic tool. Using this we can diagnose a child whether the child is suffering from PEM or any growth disorder or not, and also it is a tool for education. The chart is very simple to understand and very simple to depict and very simple to analyze. So we can use it to educate less educated people. Okay. Usually ASHA workers or Angani workers, they are only 8 to 10 pass, okay, not more than that. That is why it is a very useful tool, and also it is a tool for action. That was the question from, if the child falls in the red zone, what you will do? We have to take action. So from the growth chart we can easily interpret whether we have to take action right or now. If the curve is deviating from the normal phase, we will take the action, okay. And also it is a tool for evaluation or effectiveness of corrective measure. After giving the intervention or the treatment, whether the child is responding to the treatment or not, we can understand from that. So that is also thing, it is a tool for evaluation and tool for teaching, and also tool for planning and policy making. From an area, if we see the maximum childs are getting in the red zone or in the yellow zone, so there must be missing something, one nutrients. So those who are sitting in the higher level in Delhi or suppose in our Sastha Bhavan, they can try and they can make a policy or they can investigate what to do there, okay. In park, these are 7 points are written this like this, but my advice, when you are writing, if the uses of growth chart is given in your exam, write like this, that what are the individual level uses, community level uses, national level uses, and what is the scientific purpose, okay. PPT to patiye dewa hobe, please write like that, okay. Now coming to the making the chart, ki kore amra banabo, how to make the chart. For that we first have to know the what are the normal things, what are the normal child is done. So what we can do, first we can go in the community and give the child optimal nutrition, okay. Optimal nutrition, optimal means as they required, not over, not the less, and see their growth pattern. It will create a growth, it will create a growth pattern, and we can make the chart from it. We can use it as reference, or we can see the normal people in our community, normal, not normal people, normal child, those who are actually living normally, we can see their growth pattern, and from there we can get a mean curve, okay. যদি বাংলায় বলা হয়, আমরা হচ্ছে গিয়ে যাচ্ছি তে 100 জন বাচ্চাকে আমরা খাবার খাওয়ালাম ঠিক তাদের যতটা দরকার, তারপর তাদের গ্রোথ চেক করলাম, অথবা 100 জন বাচ্চা যারা হচ্ছে অলরেডি বেঁচে আছে এবং নর্মাল হচ্ছে গিয়ে তাদের গ্রোথ নর্মালের মধ্যেই আছে, আমাদের যেটা অলরেডি তৈরি করা, যেটা হিউম্যান ইয়েতে আমরা স্টাডি করে পেয়েছি, তাদের আমরা ডায়েটারি তাদের গ্রোথ প্যাটার্নগুলো একটু হলেও তো আলাদা হবে। 100 people will show different type of growth pattern, but it is not deviated, and from that we can create our own mean growth curve, and it will be vary from region to region also. আমরা কাউকে অপটিমাল দিয়ে অনেক, there are many children who are not getting the optimal nutrition, but are they not living, and are they not, their growth rate is different? No, because there are, nutrition is one factor, there are also multiple factors. We cannot assess those factors, and we can say that it might affect, but sometimes it might not affect. Okay. And also there is the race thing, Caucasians have different type of, Mongolians have different type of growth. That's why two terms generated, one is growth standard and another is growth reference. Okay. What are the growth standards? Where how a population of children should grow given optimal nutrition and optimal health. If we give them optimal nutrition and we say their health is in the optimal stage, what is their growth rate? That is the growth standard. And what is the reference? How children are growing rather than how they should be growing. Understand that we are not getting a simulated environment. In a simulated environment, growth standard is used, okay, where everything is up to the par, up to the adequate level, but we are not living in these conditions. So, in normal things, we are only seeing how the children are growing, not should be. Okay. So, these things are growth standard and growth reference. From growth standard, and which one to use? Because there is always scarcity of money, we will go by growth reference obviously. It is not possible to use growth standard, right na? So, what are the, from growth standard and growth reference, two types of growth chart actually born. WHO 2006 is actually growth standard, okay. It emerges from the MGRA study, and growth reference they made earlier. It is CDC 2000 and also the IAP growth curve and also the curve we use in the MCP card. Okay. These growth reference cards, what are the advantage? It all have some advantage and disadvantage. If the growth standard, what is the main disadvantage? It's a overdiagnose of people of malnutrition. You all now you know it's a screening tool. There will be more overdiagnosis mean what? Overdiagnosis of PEM, but they are not PEM probably. That means what category they are falling into? False positive for PEM. If we use growth standard growth chart, there will be optimal nutrition, they are not given, but their growth is somewhat normal, it is not deviated. So, but by chart they will diagnosed as they are having growth disorders sometime or growth deficiency. So, it will falsely diagnose them as growth deficiency when there is no growth deficiency in their case. So, growth standard will overdiagnose people as growth deficients because not everybody living in a optimal condition. So, the increase of false positive is maximum. And what will do growth reference? If we use growth reference, the biggest disadvantage is need to update once in a decade because it is likely to diagnose overweight children as normal. So, false negative will be much more, underdiagnosed, because it is a normal in some region and we are not, we are also going through the evolution na. So, if we do not update those charts in a decade, or decade is not the word, 5 years or 10 years or 15 years, we have to update it constantly, otherwise it will miss the evolutionary changes and what it will create? False negative people. What are the advantage? These are the points you will not be asked. Okay. What is the disadvantage of using growth standard and growth reference? It has been asked. Okay. And what are the difference between them? It might come as a explain why that growth standard and growth references are different thing. You have to write all these things. What is it? What is the example? What is the advantage and what is the disadvantage? And this false negative and false positive things has been came in MCQ. Okay. So, coming to the first thing, that is WHO growth chart. Okay. The participating nations name are important. It happens in Brazil, Ghana, India, Norway, Oman and USA. Is it representing the whole world? Or the sampling জিনিসটা তো পড়েছো? Is it representing the whole world? কোনো একটা জায়গা বাদ গেছে কিনা সেটা ভালো। হ্যাঁ? Why Russia? তো রাশিয়া প্রেম কেন? Huh? If you think about the geography, there are South America, 6 continents. Huh? 6 continents, right? তো আরেকজন রাশিয়ার ভক্ত বেরিয়ে এসছে। হ্যাঁ? অস্ট্রেলিয়া, অস্ট্রেলিয়া থেকে নেই, তাই না? এবং এন্টায়ারলি সাউথ ইস্ট এশিয়া, ইজ দেয়ার এনি মঙ্গোলিয়ান রিপ্রেজেন্টেটিভ কান্ট্রি? ঘানা যে ওখানে বলেছে সে আরেকবার 7-এ পড়তে যাও। Brazil, Ghana, India, Norway, Oman and USA. Is there any Southeast Asian country? Indonesia, Malay, even China. China is not Southeast Asia, but there is no Mongoloid representation, Mongolian representative country or Southeast Asia country. But where they actually get permission, they also to conduct the study, they need the permission of the country. Okay. চায়না তো মনে হয় না কোনো কিছুতেই পারমিশন দেয়, ঠিক আছে? ওখানে গুগলও বোধহয় ব্যান্ড, হোয়াট এভার। সো these are the somewhat representative of the world population and the data is collected. What are the tool? There was weight for age, weight for height and data on BMI was generated for children of under 5 for the first time. Okay. From there the WHO growth chart has been made. These are the blue for boys. It is from birth to 5 years, and if you go by internet, there right now there are multiple types of growth charts. Okay. But there are main 3 types of chart, that is weight for height, weight for age, height or length for age. Length কাদের জন্য? Huh? Below 2 years or bedridden. Okay. And in India, ICMR actually first done a nationwide study in 1956 to 1965, and in 2010 to 11 this name has been asked, believe it or not. That's why I made it in red. Okay, Khalid Kar. I don't know who he is and whether he is alive or not, but remember the name. Okay. These are the first time growth chart made by ICMR. Now the picture same. This is the weight for age and for girls. Okay. And here it is written 97th, 85th, 50th, 15th and 3rd. What is this? What are the lines? What are the lines? What are the lines? It's written in here, that is percentile lines. If it is coming to the 85th percentile of the growth, the children is belong to the from suppose 50 to 85th. Okay. So what you will tell about his growth? What will be your comment? It has been asked, MCQ, Viva, so many important questions. So কি বলবে? এই জিনিসগুলো তোমাদের পরীক্ষায় জিজ্ঞেস করা হয়েছিল যে যখন বলতে হতো যে হোয়াট ইজ দিস চার্ট, দিস ইজ এ growth chart of boys of 0 to 5 years or 0 to 3, হেডিংটা দেখে দেখে ওইটা লিখবে, ওকে, ইন এক্সাম। অ্যান্ড in its x axis it is suppose age or height or weight যাই আছে, and in y axis এই, সো দ্য গ্রাফ ইজ এত। এমনি এমনি 2 মিনিট তো দেওয়া হয়নি, এই প্রত্যেকটা পয়েন্ট লিখলে তবে ওখানে তোমাদের 1 পাওয়া উচিত, আদারওয়াইজ হাফ। শুধু গ্রোথ চার্ট লিখলে তো হাফ ওটা 25% দেওয়া যায় না, তাই সমস্যা। তো ওখানে পুরো একই কেটে নেওয়া হবে। এবারে হয়তো কাটা হয়নি, নেক্সট টাইম কেটে নেওয়া হবে, কেননা দ্যাট ওয়াজ দ্য ইনস্ট্রাকশন, ওকে। These things you have to write, that whether it is of boys or girls, whether it is WHO or not, MCP কার্ডের গুলো কি সেটাও দেখতে পাবে। সো WHO এর MCP you have to identify that. Then you have to identify what is in its x axis, what is its y axis. Then final conclusion, this thing is that, okay, this type of growth chart. Then coming to the interpretation, whether the whatever the question it is, red zone or yellow zone or green zone. So what will be the comment here? If it is between the 85th and 50th, in your MCQ apps also there are results that 50th percentile in marrow. What is the meaning of that? না না, আমি ম্যারোটাই বলতে বলছি, ম্যারোটাই বলো। 50th percentile, 50th percentile have answered this. ম্যারোতে এইভাবেই আছে তো এখনো, নাকি না চেঞ্জ হয়ে গেছে? ম্যারোর নাম শুনে এমন তো কেউ নয়। হোয়াট ইজ, কিভাবে আছে? You all studied biostatistics. I am asking that why. If it is telling 50th percentile, what is the meaning? যতজন দিয়েছে তার মধ্যে 50% এটা কারেক্ট অ্যান্সার করেছে। I think the comment is coming like that. You have in the total result you have surpassed 87th percentile or 78. So those who have given the exam, 78% actually crossed up to you. So that it is, if it is getting too much higher, actually the question is easy, not you are giving a good answer, or okay. Or sometimes they also previously they given the result as you are ahead of 78%. But what I heard right now, they are giving that in every MCQ 80% of the people actually answered this. So if you have answered wrong, 80 people are ahead of you, okay. 80% of people are ahead of you, not 80 people, okay. So here also meaning that 50th or 80th, 85th percentile, what will you say? What is the meaning of that then? You are ahead of 50% of the population. It is getting to the higher, na. So 85% people is, you are 85% you say behind you. Yes, yes, correct. So if it is between the 50th or 85th percentile, suppose it coming as 60 or 75%, this percentile of the population is behind your growth, okay. So it might be the normal growth or overgrowth. It is not usually correctly interpreted using that, okay. That's why it is easier to use MCP growth charts rather than WHO growth charts. These are the IAP growth curve, okay, 2007. Do not just see the picture. If probably came in MCQ, you can understand, because they will blur these things, okay. They will be given only this. So what are the basics? It consists of x axis, which is usually in years or months, and y axis that changes according to the reference, centimeter, inches, kg or kg per meter square, because what kg per meter square, that is BMI for age, okay. WHO or even we also have a growth chart for BMI for age, okay. And x axis usually divided into 12 equal parts, that for months, and the percentile interpretation is much harder. So we shifted to Z score. You all know how to calculate the Z score. Stat একটা question ছিল তো Z score calculation নিয়ে. So I am assuming all of you know how to calculate the Z score, and we also shifted, that's why we shifted to Z score value. Okay. So if the 50th percentile the Z score is 0, that means it is following the exact ideal growth reference curve. There is no deviation. Z score is the measure of deviation, na? -1 50th percentile or 15. You do not have to remember this, just see -1, -2, -3 and 1, 2, 3. Minus for negative growth and positive for +1 for positive growth. So now if we tell the percentile curve is likely that if you are getting minus, not percent, sorry, Z score graph is like that. If you are getting plus, your growth rate is ahead of the normal growth reference curve. It might be overgrowth or it might be not. There is category also in which +3, if it is more beyond the +3, so it is extreme deviation from the normal curve. So we can, if it is in, so we can call the child that his growth is overgrowth is here, and if it is to -1, -2 or -3, there will be undergrowth. That is why where we have to intervene, and that we do not think about +1, +2, +3 previously. Right now we are also thinking on that, what to do with overt babies or gigantic babies, those who are suffering from some hormonal imbalance. You see in newspaper, there are sometimes some news about some children who are eating too much weight. But previously, as we are a poor country, so children are poor in nutrient, so we are focusing on the -1, -2 and -3. Okay. So -1, -2 and -3, here we give them a color code. What is the color code? First, if there is -1 deviation, do we have to think about too much, or is we will tell it as some normal occurrence, it will catch up, or -2 even? বলো, যদি ওটা -1 থেকে -2 এর মধ্যে থাকে, আমাদের কি অ্যালার্মিং স্টেটে যাওয়ার প্রয়োজন আছে, না আমরা ধরবো যে না ইট ইজ সামওয়াট নর্মাল, ও ঠিক হয়ে যাবে, যেমন আছে চলুক? কালার কোডটাও এর উপর বেসিস করে তৈরি হয়েছে। অ্যাজ অলসো we have to, you already studied triage, না? ট্রায়াজ হচ্ছে গিয়ে কাদেরকে দেব, তো আমরা কি হচ্ছে গিয়ে যারা অল্প কেটে ছড়ে গেছে তাদেরকে ট্রায়াজে কি আগে দেব প্রায়োরিটি? না, we will tag them as green or yellow, probable yellow, or red and black. For black is for doing nothing, we have to do nothing, and red for immediate action. So first we have to think that those who are then -3, we have to take action immediately, so they are getting the highest priority, so their color code is red. And those who are between -2 and -3, they are somewhat less priority, we will giving them yellow, and rest of the up to 0 to -2 is green. And this is the interpretation for height for age and weight for age. So if it is -3 as was in your semester, what is height for age? Sorry, this is -3. What is the interpretation? Height for age is looks for stunting. So if a child's question কি ছিল যে if a child's growth is coming to the red zone or less than -3, what is the interpretation? This is the word you have to write. The child is severely stunted if the growth chart is for height for age. Height for age হচ্ছে স্টান্টিং দেখে, স্টান্টিং প্রেজেন্ট না নট, এবং তার উপর -1 even is considered as normal, less than -2 SD is stunted and less than -3 SD is severely stunted. That is the word we expected from all of you guys. I don't know whether it was in the second day or third day, this was the words expected. কতজন লিখেছো তোমরাই জানো. And coming to the weight for age, if coming to -t it is -2, it is coming as underweight, and if it is -3, severely underweight. Okay, and there is another curve, that is height for or length for age, sorry height for age hoye gelo, weight for height. Okay, if there is weight for height curve growth chart, what will be the -3? Wasting. The word is wasting. The interpretation, rest of the interpretation is same. -1 is normal, less than -1 is normal, less than 2 is wasting child, and less than -3 is DS, severely wasting is present. Okay. So stunting, wasting and underweight, তিনটে ওয়ার্ড কোথায় কোনটা ইউজ হয় প্লিজ রিমেম্বার কারেক্টলি. ওকে, so 2007 we actually IAP and MUAC jointly made a Indian growth chart which is we now used in the MCP card. Okay, what is the looking like this, how it look, this is actually up to, you do not have to think about the upper part, this part, this is -1 or -2 sir, মাইনাস কত, মাইনাস না প্লাস, কত কত, -2 না -3, রেড জোন ইজ, রেড জোন কি লেস দেন -3, তাহলে এইটা যদি -3 হয় এটা কত, আরে জিরোর মাঝখানে আছে, এটা উপরেও একটু আছে, এখানে +1ও ধরা আছে, জিরোটা ভাবতে হবে না, বাট না +2 হয়তো ওবিস, +2 এরও ইন্টারপ্রিটেশন আছে টেবিলটায় দেখবে. And why the growth chart, I বললাম যে why we should not give it one time, we have to take it multiple times. If the growth chart trend is that, this one, it is coming as very dangerous, whatever the region is. A child growth was in, suppose here, but now the curve is showing like that, it's still on, not on red, but it is declining. This is a very dangerous thing, that's why continuous monitoring is done. Okay, not a single point, and this one is the accurate and what is expected, and this is dangerous, this is plateau, যতই খাওয়ানো হোক একই কার্ভে একই লাইনে যাচ্ছে, it is going on a straight line, there are no upward lift, that is dangerous. And what is this declining, it is very dangerous. If the MCP card next time in your semester it might come as that, এটাই হচ্ছে প্রিন্ট করব, একটি আমি লাইন টেনে দেবো, you have to interpret. Okay, actually this time that was the question, we changed it because whether you know or not know, and this thing will be blurred obviously, so there will be no reference. Okay, and growth, last only question to you guys, okay? If যা দেখলাম everything is somewhat age dependent, weight for age, height for age, is there are age independent markers of growth? Is there is any age independent marker of growth for children? বলো, mid upper arm circumference, very good. Another one, hello, scapula, head chest circumference, head circumference, এগুলো কি দোষ করলো, ওয়েস্ট বাচ্চাদের দেখে। There are also এক্ষুনি একটা দেখলে weight for height, is the age is a factor there? Weight for height, that chart is also age independent. She said correctly mid upper arm circumference or MUAC, that is also. And if I ask for adults, what is the age independent marker? BMI, weight by height square. Okay, that is for today. Any questions?